Thank you. The final item of business this evening is the members' business debate on motion 13791 in the name of Faisal Chowdhury on the importance of medical technology for patients with diabetes. This debate will be concluded. Sorry, Mr. Chowdhury, could I just finish my introduction? This debate will be concluded without any questions being put, and I call on Faisal Chowdhury to open the debate. Around 7 minutes, please.
Thank you, Presiding Officer. It is an honour to open my members' debate. I thank all members who have signed the motion and everyone who has chosen to attend today to discuss this important issue. I also offer special recognition to the campaigners and Type 1s who are watching in the gallery and, of course, online, and thank them for their hard work. 36,000 Scots live with Type 1 diabetes, a chronic condition which cannot be prevented and must be managed 24 hours a day. People with Type 1 must constantly adjust their insulin levels based on what they have eaten or how much physical activities they have done. There are at least 42 different factors which are blood glucose levels. Too much or too little insulin bring with it a number of health issues, including hypoglycemia, heart disease, or blindness. Diabetics technology, which refers to technology for administering insulin, checking blood sugars, and general management, can be transformational in improving the quality of life of people living with Type 1. The most effective from diabetics technology is called a hybrid closed-loop system, which involves an insulin pump combined with a continuous glucose monitor that automatically doses insulin. It means less finger pricking, no more injections, and no more planning your life around your condition. It is the closest thing we have to a cure. But this life-changing technology is sadly unavailable for so many. In October, I hosted a roundtable on the diabetics technology, where I heard from the health practitioners and people living with Type 1, including the story of a woman. We will call her Jane. Jane described a constant battle to keep her blood sugar at the right level. She said she would wake up every night sweating and drowsy with low blood glucose. Her diabetes affected her hobbies and ability to drive her car. One day, she was forced to do 8 injections and 16 finger pricks. She described her situation as a never-ending cycle of despair. People with Type 1 diabetics make, on average, 180 more decisions each day than those without. The impact of technology in lessening this mental burden and improving well-being is massive. Except Jane doesn't have access to a closed-loop system. Jane, like so many others, has faced the twin battles of long waiting times and a shocking lack of choice in how their care is delivered. The waiting time for an insulin pump is over a year in every NHS board, with the longest wait coming in it over 5 years. And the number of people referred to NHS Lothian for diabetics technology is projected to grow to 1,200 by March of this year. This alone should be alarming, but even after being seen, diabetics patients are being failed. There is no single treatment for diabetics. Diabetics devices have different algorithms and features for managing blood glucoses. For example, some devices have Follow Me function, which allows parents and carers to track their child's glucose level using their mobile. This is essential if a child is to go out to play or safely compete in sports. Choices in technology is explicitly recognized by SIGN Guideline 170, which states adults should be offered choices based on their individual preferences, needs or characteristics. But in Scotland, this is not followed, with many NHS boards offering only one device. Jane was told the pumps she needed to manage her condition were too expensive. Users are being moved to less suitable options, putting them at risk. The safety and the needs of users must come first. In England, people are given a choice. Type 1 diabetics does not change once you cross the border. Why should type 1 ones in Scotland miss out and receive worse care based on where they live? We must see actions to ensure SIGN guidelines are followed by the clinical team. Last year, the Scottish Government pledged up to £8.8 million to increase the provision of diabetics technology. Improved funding is, of course, welcome. But despite the new funding, NHS Lothian states diabetics technology remains a significant financial pressure. Treating complications from diabetics has been found to cost the NHS approximately 10% of its whole budget. And the University of York found a productivity loss to the UK economy of £3.3 billion. Diabetics technology is genuinely preventative care which will save the NHS money in the long term. And we should be doing far more to ensure it is widespread. England have a 5-year plan to get 90% of children and 50% of adults diabetic technology. The Scottish Government should be as ambitious or more, with a long-term plan to get every adult and child the technology they need. Adequate multi-year funding and full implementation of SIGN 170 to guarantee choices in devices. I want to finish by asking members to place themselves in the shoes of our type 1s. Knowing the technology to change your life is available, but there is no political will to ensure you get it soon. Imagine the frustration you would feel day by day. We cannot just tell people to wait. People with type 1 diabetics should not have to fight for their care. Thank you.
Thank you, Mr Chowdhury. We now move to the open debate. Backbench speeches of up to 4 minutes. I call Emma Harper to be followed by Annie Wells. Ms Harper.
Thank you, Presiding Officer. I congratulate Faisal Chowdhury on securing this diabetes tech debate. And I also want to thank Diabetes Scotland and the Insulin Pump Awareness Group for their briefings ahead of the debate and for all the work that they do to support people and families living with diabetes. I will remind Chamber that I am a type 1 diabetic and I use a hybrid closed-loop system myself. I was diagnosed on my 12th birthday, and that wasn't yesterday, Presiding Officer. Two of my sisters and my mum also have type 1 diabetes. I got my first pump 25 years ago when I lived and worked in Los Angeles, and that's where the Medtronic pumps are manufactured. And given my professional background and as a nurse, I joined the cross-party group on diabetes in 2015, before I even was elected to this place, and now I am co-convener of that cross-party group with Paul O'Kane. You'd think I would be a total expert in managing my own blood glucose, counting carbs, managing exercise, doing all that balancing, but I'm not. This work environment that we have right here doesn't make it easy. Diabetes is relentless. It's part of life 24/7. There is no opportunity to take the day off without facing some consequences. And I want to thank my diabetes team in NHS Dumfries and Galloway for their support, especially their non-judgmental support, because that non-judgment is vitally important. But this debate isn't a woes me debate, though, Presiding Officer. I would like to mention that, already there are 33,452 people living with type 1 in Scotland. Type 1 diabetes is associated with physical and mental health problems that can be caused by the demands of managing their diabetes daily, coping with diabetes-related complications and worrying about future complications. Diabetes-related complications do place a substantial burden on the NHS in UK, and Mr Chowdhury has mentioned this. The UK spends about £10 billion annually on diabetes, and 80% of that is treating complications. I've raised this at Health Committee many times in this session and the previous session, Presiding Officer, and given that people with type 1 diabetes could or have access to the right technologies to manage their condition is a priority in the Scottish Government's Diabetes Improvement Plan. I welcome this. And we know that demand for closed-loop systems and the artificial pancreas is increasing, and many people with type 1 diabetes expected to benefit from these systems in the future. Presiding Officer, the motion mentions that people living with type 1 diabetes make an extra 180 decisions every day. I read that information in a Stanford Medicine blog, which focused on avoiding hypoglycemic seizures during sleep. That is a particular issue when it comes to paediatrics. That's why the technology is so fantastic for parents to help monitor their wean's blood glucose overnight. So I do think the burden of any number of extra decisions is pretty valid to reflect upon. And managing diabetes for optimum blood glucose control requires making decisions on managing blood glucose levels, dietary intake, working out how many carbs, protein and fat is on your plate, whether those carbs are low glucose index or high glucose index carbs, how exercise will interfere with the glucose levels, and whether you have a backup or replacement supplies in the car or at home or in the office in case the pump cannula becomes dislodged or even pulled out. And just as we were sitting down, Presiding Officer, my continuous glucose monitor alerted me that it needed changed. So I don't have any monitoring of my blood glucose for the next hour until I get up to the office. And using the tech, it does minimise manual interventions, it does simplify decision-making, and it does ease the burden of the mental workload. We know the tech has been described as absolutely transformative in the self-management of diabetes. However, Presiding Officer, the availability of the tech is not equal across Scotland, and we've just heard that. And I note from the member there are specific challenges faced in Lothian. And we have heard this at the CPG and at the recent diabetes event that I hosted here in Parliament. We know there can be many complex reasons for this disparity, but there is no doubt that funding plays a part. I am aware of the work of the Health Improvement Scotland's Health Technology Group that they've carried out and the recommendations for the closed-loop systems. And, of course, we should highlight the SIGN guidelines. So I ask the Minister to continue to work and implement the Diabetes Improvement Plan and to work with health boards to ensure that all those who can benefit from diabetes tech have the opportunity to do so. Thank you, Presiding Officer.
Thank you, Ms Harper. I call Annie Wells to be followed by Sarah Boyack. Ms Wells.
Thank you, Presiding Officer. I want to start today by thanking my colleague Faisal Chowdhury for proposing today's debate on behalf of those living with type 1 diabetes across Scotland. And I also want to thank Emma Harper for sharing her own story of her journey with type 1 diabetes. Thank you, Emma. This debate today does focus on how important medical technology is, but more specifically, diabetes tech. And it's for individuals managing diabetes, as we've heard. According to Diabetes Scotland, this is tech which aids people in monitoring their blood sugar levels or taking insulin and their glucose as well. And these include insulin pumps, continuous glucose monitors and HLC systems, which connect a continuous glucose monitor with insulin pumps to automatically adjust insulin levels in many instances. This tech spares people living with diabetes from having to do that painful finger prick test regularly. And given that this technology is a vital part of people's lives who live with type 1 diabetes, proper funding is essential in ensuring their needs are met. And last summer, the Scottish Government recognised this through its £8.8 million commitment to improving access to diabetes technology, which is very welcome. The same commitment was meant to align with the Scottish Health Technology Group recommendations and sign guidance, which are designed to give young people and children access to where they can exercise choice. And despite this positive commitment, concerns remain regarding accessibility and choice. For example, numerous families feel their needs are not being met, as while central funding does cover insulin pumps and glucose monitors for under-18s, their options are still quite limited. And this can contribute to negativity to people's quality of life, which already is impacted by managing their diabetes. And according to IPAG Scotland, to do so with type 1 diabetes, as we've heard, also another 180 extra decisions must be made by that individual every single day. Accessible technology that provides real-time information can significantly improve this daily challenge. These challenges remain ongoing, so what can be done to address them? Fortunately, organisations like Diabetes Scotland and IPAG Scotland have spelled out some recommendations with this goal in mind. They have advocated for regular reviews on how funding is used, promoting greater access to hybrid closed-loop systems and tailoring approaches for paediatric-specific needs like remote monitoring. Moreover, they have pressed for ensuring that guidelines are followed by all health boards and clinical staff to ensure safety and that patients and their families are informed of all available choices in diabetes tech so that they are empowered through their choice. To conclude, Presiding Officer, there are currently around 36,000 people across the country who are living with type 1 diabetes. Clearly, there is a need to address shortcomings in diabetes technology that can help them lead better lives. And I join campaigners in welcoming the Scottish Government's financial commitment last June, but also join them in believing that this is one part of a long-term approach. And I look forward to working with members from right across the chamber to help make this a reality. And I am eager to see what positive changes we can bring for people living with diabetes in 2025. Thank you.
Thank you, Ms Wells. I call Sarah Boyack to be followed by Christine Graham. Ms Boyack.
Thank you, Presiding Officer. And I want to start by thanking my colleague Faisal Chowdhury for securing tonight's debate. His motion could not be more timely. The progress on diabetes technology illustrates the very best of human ingenuity. Before 1921, a diabetes diagnosis was a death sentence. Now, just over 100 years later, we have technology like the hybrid closed loop, which can monitor and administer insulin without any input from the patient. And we now have modern technology which allows those with type 1 diabetes to live longer lives, eat what they want, win Olympic medals. Diabetes no longer has to be the burden it once was. This technology is incredibly effective. It can fundamentally change a patient's life and can bring their blood sugars to safe levels, thus avoiding further complications. The problem is the tech isn't making its way to patients quickly enough. I am constantly receiving correspondence from constituents who are just unable to access this life-changing technology. My own FOI request revealed that there are almost 1,000 people sitting on waiting lists for an HCL system in NHS Lothian. And it's incredibly disappointing that even in our own capital city, we are unable to make progress on rolling out HCLs at the scale needed. It's vital we invest in this technology, and we mustn't let the upfront cost of these techs cloud the massive impact they have both on patient outcomes and the wider NHS. We all know our NHS boards are under immense pressure and staff are doing their best under challenging circumstances. But if we could roll out this technology faster, the benefits to our NHS would be extraordinary. In the stats given to me by Dexcom last year, diabetes costs NHS Scotland £1 billion a year, 800 million of which is spent treating avoidable complications associated with diabetes. And that's why investing in the tech is so vital. It saves money and capacity right across the NHS. I am appreciative of the Minister for her collaborative approach to the issue. I've corresponded with her on many occasions, and we need to keep pushing for action because patients don't feel they're getting the support they need. One of my constituents thought he'd been on the waiting list in 2021, but only found out upon inquiry that it wasn't added till 2023. And another is unable to get the HCL system as only one manufacturer is offered in Scotland. In another constituent, she was on the trial for the hybrid closed-loop system and was amazed at how life-changing it was. Her HbA1c dropped and she saw vast improvements in her glucose levels. But on completion of the trial, she was told she wouldn't be able to keep the HCL and instead had to revert back to her previous system. Those with diabetes have already got greater pressures placed upon them, whether it's the extra financial cost of ensuring their snacks and emergency glucose are always supplied, or the pressures mentioned both by Emma Harper and Faisal Chowdhury about having to make 180 extra decisions a day. This is not just about people's health, it's about giving people a much greater quality of life. So we must keep working on this issue together, and I hope the Scottish Government continues to work constructively with us and health boards to make sure this tech is rolled out as soon as possible. Because it cannot be right that people on lower incomes in Lothian are less likely to access this tech. It's life-changing tech. It keeps people well and healthy, enables them to be economically active, and it's investment that will pay back and save our NHS money. So we need to see those patients who could benefit from this tech now receive it as soon as possible. Thank you.
Thank you, Ms Boyack. I call Christine Graham to be followed by Brian Whittle. Ms Graham.
Thank you very much, Deputy Presiding Officer. I too congratulate the member on securing this debate. I take you back when it was the only method, and indeed this is still the case for too many, the constant pricking of fingers to obtain the blood sample, checking and then have to inject insulin to redress falling blood glucose sugar levels. And not just once in the course of the day, your type 1 diabetes dictated your daily life. I had colleagues, indeed have family members with type 1 diabetes, who were once required to use this system. Often it was only when they became aware that their levels were falling that they tested. If that had gone too far, then there were dangers of a hypo with all the health problems which would follow. And this was, of course, a particular worry for children with diabetes. Today, there are very welcome technical devices, and because of the technicalities, and I'm not good in technicalities, I'll tread warily. For example, there is flash or CGM, or indeed hybrid variations thereof. As I understand it, with a CGM, your latest sugar levels show up on the device or mobile automatically transmitted by Bluetooth. With a flash glucose monitor, it's only when you wave or scan your device over your sensor, that's that little white button thing on your arm, that you get your sugar readings. This I've seen in operation with a family member, but she has also added to it an automatic pump or insulin, so that's what I mean by hybrid. Because these systems have to be tailored to the individual, it's not simply a matter of the NHS handing over the devices. First, they have to be clinically recommended, and then an individual must be taught how to use them and feel confident with the use of them. But what a difference it makes to everyday living, which I've observed with my family member. It becomes every day, and not with a constant and inhibited concern about blood sugar levels. But with experience and the right technical device, it all takes care of itself. As I said, I've seen this in a family member who has, as I explained, a hybrid flash plus the automatic pump, which is so discreet. For parents and carers of children, it's a godsend. As you will appreciate, the technology can be accessed and monitored by a parent or carer, especially overnight when worries would grow. Now, the Scottish Government, as I understand it, provided Scotland-wide last year with £8.8 million of funding for the expansion of access to diabetes technologies to support the purchase of new kit, though it's not allocated directly to NHS boards, but part, as I understand, of their overall support. So while I very much welcome the investment as preventative spend, as others have mentioned, but more importantly, releasing those living with diabetes from the worry and travail of the old methods. Now, I know there remain issues with supply of pumps and associated technologies, others have mentioned, So I will be checking again with NHS Borders the position for 2025, and I await the Minister's comments in her summing up, because it does seem to me the right and decent thing to do for people with type 1 diabetes and prevents more serious health issues in the mid to longer term. Thank you.
Thank you, Ms Graham. I call Brian Whittle to be followed by Carol Mochan. Mr Whittle.
Thank you, Deputy Presiding Officer. Could I add my congratulations to my colleague Faisal Chowdhury for bringing this debate to the Chamber. I think most people know that I have a long-lasting interest in health technology in general, and actually very specifically in diabetes. And my colleague Emma Harper and I co-chaired the cross-party group on diabetes last term, and that was really when I really began to understand, and we really pushed really hard to have the adoption of technology into diabetes. And I have a very specific interest in this because I actually used to coach somebody with type 1 diabetes and then had to learn along with him how to manage his condition while training. And I watched I used to come down to training and he'd take a prick of the finger to understand where he was, and he would manage it with a drink of a certain fizzy drink, how he would manage his blood sugar levels, and then continually through training have to continue to do that pinprick of his finger. To manage that session. Now, he was very successful. He medalled at in Scottish 1500 metres. But I did feel that and I am obviously, as you're well aware, an advocate of managing health with exercise and diet. And I did feel that because he happened to be a sports person, it did give him that incentive to manage his condition as well as he possibly could through that methodology as well. And I also have a friend who, always makes me tear up every time I think about this. He has a daughter who was born type 1 diabetic, and she also had the pinprick in her stomach, and he actually used to pinprick his own stomach as well at the same time to be with. So it was a shared experience. And I just think that is just a wonderful parent right there and then. But the whole idea, and I think I go back to when I was co-convener of the cross-party group on diabetes, when we were pushing this. We're going back 5 or 6 years ago, and the government put money forward to do a trial on this. And it's very obvious, as members have said around this chamber, it's very obvious the real positive impact this has on quality of life. The fact that parents don't have to wake their children up in the middle of the night to test the blood sugar level. That whole ability to have much more of a normality in terms of life it's obvious. Notwithstanding the fact that the cost to the NHS, as has been said, is something like 10% of the Scottish budget on health is spent on diabetes, and the complications in diabetes. All that money that we could take from there and reinvest and reinvest and reinvest. And I think we need to have a programme that pushes that further upstream so that we get to a stage where those who are suffering from specifically type 1 diabetes have access to this technology. It is such an obvious thing that we have to do, and it does worry me that it's taken this length of time. Here we are 5-6 years later from being that convener of the CPG, we're still talking about this. And I do think that, I'm going to mention type 2 diabetes, just slightly going across into a different area, where I think this idea of exercise and diet, this idea of changing behaviour, can not only prevent, in many cases, type 2 diabetes, certainly prevent the deterioration, but even put it into reverse. And why is that important? The reason that's important is because if we can save that money on type 2 diabetes, it releases even more money to develop cures and to develop treatments for type 1 diabetes. So, and that, I will stop there. And again, I would just like to congratulate my colleague, Faisal Chowdhury, on bringing this to the Chamber and allowing me to speak once again on diabetes. Deputy Presiding Officer.
Thank you, Mr Whittle. I now call Carol Mochan, who's joining us remotely, to be followed by Miles Briggs. Ms Mochan.
Presiding Officer. Thank you, Presiding Officer. Thank you to Faisal Chowdhury for bringing this debate to the Chamber. I was really interested to see it on the agenda and really interested to hear from members tonight. We've spoken before in the Chamber about diabetes and diabetes care, so I know the enthusiasm amongst members on advancing this issue, as well as some of the expertise members bring to this issue. Emma Harper, I hope, knows I have a great deal of respect for the work that she has done on the cross-party group and the way in which she shares her own stories. I too, in a previous role, have some experience of working with patients who had diabetes. I spent many years in the NHS working as a dietitian, and in my early career covered diabetic clinics, along with the specialist diabetic nurse and other members of the multidisciplinary team. Diabetes is a condition that patients manage and live with, and I learned so much about the adaptability, resilience and the humour of people following diagnosis of such a life-changing condition. It also gave me a lifelong admiration for the dedication of NHS staff in building up relationships with patients who have enormous hurdles and many years of treatment to overcome. And I always like to give them a big shout out to all the staff, and this includes those working in the background in research and medicine development, and of course, as we're discussing tonight, medical technology. In a previous debate, we spoke about insulin and its relationship to diabetes. We all agreed it's one of the greatest medical breakthroughs in history. It changed life for so many millions of people, changing diagnosis of type 1 diabetes from a death sentence to a life worth living. And I still think about our responsibility to make life all it can be for people. How, as medical technology advances, we make sure it works for those that need it and those that need it most. As we have heard here tonight, the Parliament does recognise the words of the motion. Members here have spoken about that, recognises the vital importance of medical technology. And tonight, of course, we're focusing on real-time continuous glucose monitoring and how this can transform life for those who use insulin to manage their condition. And we do understand, and other members have mentioned research at Stanford University, that people with diabetes make about 180 more decisions each day about their care and health than those without. And that access to diabetes technology can and will help to reduce that burden. If we want people to lead full lives, we do have a responsibility to use this technology. Faisal Chowdhury explained this impact very eloquently in his contribution, sharing Jane's story. Managing lifelong conditions can take its toll on individuals and their families, and so it's so important as parliamentarians we acknowledge our role in fighting for services and every possible advance be made available to people as quickly as possible to get maximum benefit. And of course, it must be made accessible to all. There are so many elements we could bring to tonight's debate, and members have done that around diabetes diagnosis, diabetes treatment, diabetes life as in general. And in a short debate, it gives us a chance just to raise one or two issues. In the time I have left, I want to talk just a little bit about tackling the inequalities around diabetes care, in particular the link between inequality and diabetes outcomes. We know from research the realities of living with diabetes, particularly if you come from a more deprived background. Over the years of research, we know that those in the most deprived homes are up to twice as likely to develop complications of diabetes as those in the least deprived. These start figures show the reality for so many where you're born and live unfairly. Where you're born and live unfairly lays out your future, particularly when it comes to health and health outcomes. Technology can play its part in tackling health inequalities. And so as we fight for these technologies to become part of mainstream care, I want us all to reflect on availability and access to medical care, treatment and technology. Let's ensure technology and diabetes care is at the forefront of reducing health inequalities and helps to improve the lives of so many of our constituents. Thank you, Presiding Officer.
Thank you, Ms Mochan. And I now call on Miles Briggs. Mr Briggs.
Thank you, Deputy Presiding Officer. Can I start by thanking my Lothian colleague and friend Faisal Chowdhury for bringing forward this debate and securing it this evening. It's a really important debate, and I welcome I've really been supporting the campaigning he's been doing on this issue for some time. And for those of us lucky enough to represent Lothian or to represent constituencies covered by the Lothian NHS Board, this is a really important issue, and it's one which I hope the Minister will really hear a call for action from me this evening on. Because I know, and I welcome many of the constituents who are in the chamber with us this evening, the levels of service which are now being expected in Lothian are falling way beyond anything any of us would expect, and has to be addressed by ministers. And I say that because I have spoken to many constituents, as I know members have raised, who have now given up on this technology being able to be given to them in their lifetimes. And that has to change, because governments say they want this to be made available. I have several letters here from ministers saying just that. But those of us who are attending Lothian NHS briefings know that that is not the case, that the financial situation which the Health Board faces, a projected shortfall of £133 million, is meaning that they have looked towards this for cost savings. Only pregnant women and children will now be made able to access this technology. So we need to see that change, and I hope ministers are acutely aware of the situation in Lothian and the need for that to be addressed. The Scottish Government, in its Diabetes Improvement Plan published in February 21, said it was committed to these technologies to improve the quality of life for people living with type 1 diabetes. And it was interesting listening to some of the stories, because one of my good friends from school had type 1, and we worked in the pub together, and I was just thinking of the way she went about her working life in a pub. I was in the kitchen with her at the time, testing, grabbing a drink, back out working. The technology we now have can transform lives, and I really welcome Emma Harper's advocacy for this, living proof of this technology, and how we should all be wanting to see our constituents have access. Because it's not just in terms of the life chances. It's estimated that actually this technology can add another 10 years of life expectancy onto people's lives. So this is about a life expectancy, but it's also about cost savings, potentially, because we see and know additional A&E admissions which are being caused. We see and know that blindness is being caused. And we know that, and for those of us who do visit hospitals, I have previously had the health portfolio talking to patients who have just had amputations because of their type 1 diabetes. We know that this will cost the NHS even more in the future. So I hope that this debate has presented the opportunity, as the charity Diabetes Scotland has called for Scotland and the Scottish Government to look to match the actions being taken in England, where they have now funded a 5-year implementation plan and announced the rollout for the closed-loop systems. It was put to me that if this was a drug, not a piece of technology, we would not be seeing this discrimination in different health boards, especially my own here in Lothian. And I hope ministers take that on board. If this is going to be provided, it has to be equitable across our country. My constituents in Lothian are seeing a lack of this technology being provided. In fact, it's been suggested to me that only 30 adults will likely receive a pump in the next 2 years. The waiting list currently stands at 1,200. So we need to see action. I hope tonight, as a members' debate, has presented that opportunity for ministers to hear our concerns, especially Lothian members, and to, in summing up, to hear from a minister exactly what the Scottish Government intend to do. Thank you.
Thank you, Mr Briggs. I now call on Minister Jenny Minto to respond to the debate. Around 7 minutes, please.
Thank you, Presiding Officer. And I too would like to thank Faisal Chowdhury for bringing this motion to Parliament today. He has reminded us very clearly of the daily challenges faced by people living with diabetes and how technology can transform their lives. I'd like to thank colleagues across the Chamber for their contributions, sharing their own experience or either with living with diabetes or supporting those that do. And I always think that's really helpful as well, to understand when someone who doesn't live with diabetes can share their experiences as well. So thank you, Brian Whittle, for that. It has been a very informative debate, and I've been heartened to hear that members across the Chamber recognise the importance of expanding access to diabetes technology. I'd also like to thank all of those that have travelled here tonight, and those that are watching, and those that have generously shared their stories with myself and colleagues. I would also like to thank Carol Mochan for raising the importance of not forgetting about inequalities and where diabetes can impact different areas of Scotland. It remains the Scottish Government's ambition to make diabetes technology available to everyone in Scotland who would benefit from it. The Scottish Government have committed to all children and young people, as well as working towards universal access for adults. I regularly hear from people living with diabetes about how important it is that we continue to work towards making this technology available for all. And I'd like to briefly reflect on where things were just 1 year ago. Many of you told me of the considerable waiting lists constituents were facing, and that many had a sense of hopelessness about lack of protected funding. And Miles Briggs and others, Faisal Chowdhury and also Sarah Boyack, all have raised the situation in NHS Lothian. And yes, I am aware of the situation there, and I'm pleased that my officials are working very closely with NHS Lothian, and it's something that we discuss a lot. I recognise that there is more to do, and I will say at the outset that I'm under no illusions that this job is complete. Before I touch on some of the key issues raised, I'd like to outline the significant progress that we have made since last year. But before I do that, I would like to thank and credit local services for the unwavering commitment to the programme. This has been no mean feat, and I want to highlight the level of work that each and every diabetes team has had to put into this. And as Emma Harper did, I'd also like to thank the staff for the non-judgmental support that they provide those living with diabetes. This year, we entered a new phase of delivery by establishing a national programme. The primary aim of this was to remove the postcode lottery elements of care many people were experiencing. The programme began in May last year with an initial investment to support 2,100 individuals to receive an insulin pump, a continuous glucose monitor or both, to create a hybrid closed-loop system. This is on top of the £29 million we've invested in diabetes tech since 2016. The initial focus of this programme has been to provide a closed-loop system to all children and young people that want it. As it stands, 64% of all children living with type 1 diabetes have access to a closed-loop system, and we expect to see around 80% by the end of this financial year. There are some health boards which have already exceeded this target. We know that access for young people in Scotland is catching up with the rest of the world, and I would like to reiterate how life-changing this will be for many families, as Christine Graham has spoken. One of the reasons we've been able to do this at pace is by commissioning a new national onboarding service. This team is comprised of highly experienced diabetes clinicians and potentially, most importantly, peer support staff, all helping people learn to navigate their new normal of living with a closed-loop system. And while I'm proud to outline the significant progress to members today, I also recognise the challenges that remain for many. There are over, as others have said, 35,000 people living with type 1 diabetes in Scotland, and demand for diabetes tech currently outstrips the capacity in the system. If I may, I'd like to respond to Annie Wells' concerns about brand choice for children. I am also aware that there is growing concern that children are not able to access the most appropriate technology for their needs. But I would like to reiterate that the national programme has provided adequate funding to allow all local services to provide any of the CGM brands available on the market. It's, however, important to note that a prescribing clinician may feel they are able to maximise access to these kits while also providing safe, effective care with more cost-efficient brands. Now, I can't discuss the costs details, but there are significant differences, and therefore our clinicians may offer the lower price brand to allow more of their patients to access the technology. but individuals and families should continue to have conversations with their clinician team. But I would again reassure members that the national programme is committed to supporting brand choice for children and young people. And Mr Chowdhury and others asked about the plan. Now, while other nations have published strategies and targets, we were fortunate in Scotland to be able to kick-start a significant rollout programme as soon as funds were released. We've also found that negotiating with suppliers to secure bulk national deals has allowed us to secure the best deals. Setting targets on these numbers may have stopped us from achieving the current prices. We're also able to work with officials to secure appropriate investment year on year and ensure this reaches the most people possible. I would reassure the Chamber that while we don't necessarily have a formal publication, we are rolling out at pace, and I'm sure that is what matters to most people living with diabetes. And Brian Whittle allows me just to talk about the preventative side as well and the work that we're doing with COSLA in collaboration with Public Health Scotland, Directors of Public Health and key local and regional and national partners around the population health framework. And I look forward to working closely with Mr Whittle and others while we look at this clear focus to prevention and the prevention of type 2 diabetes. And I completely understand that there are different approaches required for those living with type 1. So, Presiding Officer, I'd like to close by... Yes, Christine, sorry.
Briefly, Ms Graham.
I pressed the wrong button, I pressed right to speak, but there we go. What I would like to put in the record is that sometimes, and it's wrong, that people with type 2 diabetes are blamed for their condition, saying it's lifestyle. I know perfectly well this is not the case. You have a member of the family who's as fit as a fiddle, has a handicap of 2 at golf, very fit, was diagnosed with type 2. So can we just put that in the record, because there's a blame game attached to that sometimes.
Minister.
I thank Christine Graham very much for that intervention and agree exactly. I have a close friend who lives with type 2 diabetes, and I would not suggest it was anything to do with her lifestyle. So, Presiding Officer, I would like to close by recognising the continued push for a faster and firmer commitments to diabetes tech. I want to be clear that the Scottish Government continues to strive for universal access to diabetes technologies, but neither the system nor the finances, unfortunately, can support that overnight. Advances in technology are frequent, and we want to be ready to pivot to any opportunity to support at pace. I'm unable to confirm expansion rate for the next financial year, but we are continuing to work with all stakeholders to understand what support is required to do this. But the funding that we set aside in May is continuum. I reiterate my thanks to the Type 1 community across Scotland who have enabled this transformational change, and hope we can continue to work together to support access to tech for all. And
very briefly, please, Minister.
Yeah, I know you're closing. Just to confirm with you there, you said that that funding is recurring. Is that correct?
Minister.
I thank Marie Todd for her intervention, and yes, the 8.8 million is recurring. I will finish by saying that I will continue to work collaboratively, as Sarah Boyack has asked, with members across the Chamber and health boards to ensure that we give those living with type 1 diabetes the right support at the right time. Thank you.
Thank you, Minister. That concludes the debate, and I close this meeting.